This is me.
Hi, I'm Tom. I've been receiving help for my mental struggles for the last 4 or 5 years, major depressive, dissociative and panic disorders.
I've been getting better under the child and adolescent mental health services, but now I've been told that my treatment will stop, and it's all because I'm about to turn 18. In the UK, that's when childcare ends and adult care should begin. But the problem is that many young people get lost in the gap, even if they need more care, and I've been told that I won't be transferred to adult services unless I get much, much worse. So I'm ill enough for one system, but apparently not the other.
People are left feeling neglected or abandoned.
And I wanted to find out why, because to me, it doesn't make any sense. So when I saw this BBC video,
now we want to hear from you about your experiences of transitioning between child and adult mental health services in the NHS.
I got in touch, and with their help, I took our issues right to the very top.
I'm Doyle-Price. I'm the Minister for Mental Health and Suicide Prevention.
Honestly, I just think she's like really out of touch. The idea that my treatment just ends the morning that I turn 18, it doesn't make any sense to me. It's been 5 months since I was very close to ending my life.
As a mum, when you know that your child has wanted to or thought about ending their life, you just never sleep properly again. Come August, he will turn 18, and then if he relapses and is bad, there's no continuity. He can't go back to any of the people that he's been dealing with up until that point.
Got some tissue?
I'm okay.
I've come to London to talk to Professor Swaran Singh to find out about transitions between childcare and adult care for mental health. Hi.
Thomas,
Hi,
I'm
nice to
Swaran.
meet you.
Pleased to meet you. We think about 50% of young people who are receiving care from child services and who need ongoing care simply fall off the cliff edge. And that 50% figure is surprisingly consistent. It's a very, very, very big problem. And it's a shocking figure.
Why do you think that's the case?
Look, everyone doesn't need a transition. Our aim is not to keep people permanently in services. People get better. But child and adult services, they operate very differently. They have very different criteria. They have very different threshold of who they consider ill enough. So young people who are receiving care can hit a brick wall. Suddenly nothing is available. So what we've been trying to do is somehow get the two services to work together. So those young people who need a transition of care, they make this smooth journey. If the promise is there, without a doubt, the government has committed to investment, but we have not seen change on the ground. The rhetoric simply does not match the reality. Yeah. All right. It's been lovely meeting you.
It has.
Good luck. Take care.
Thank you. Thank you. Inside those buildings over there is where all the sort of decisions about how a country's run are made, and this is one of the first times that there's been such like a concrete, tactile implication for me in my future.
So I'm Doyle-Price. I'm the Minister for Mental Health and Suicide Prevention. We recognise actually that for young people as they're growing up, there's not this cliff edge where they suddenly go from child to adult. It's much more complex than that. So we'll be making more service available, treating young people right up until they're 25, so that we don't have that cliff edge transition that some people experience at the moment.
This brings me on to Thomas's second question. What are you planning to do for someone like him who's going to turn 18 in a few months' time? He's not going to get referred to adult care.
Yeah, well, someone like Thomas really should have a care plan, as part of his treatment, so that we are, properly managing through a process. That, clearly, if he's anxious about it, then that's something that we'd expect services to work with him on. I mean, I don't know where Thomas lives, but we're very clear that we expect all areas now to treat young people up to the age of 25, because we see that in some areas they have been using 18 as a cut-off, others haven't, and we've seen better care for those that have actually already started treating people up to the age of 25.
So where is it in place then, now? And if they can do it elsewhere, then why aren't they doing it in Surrey?
Honestly, I just think she's like really out of touch. Just give me a minute. Okay, yeah, I'm fine. I'm just carry on.
Okay, and I've spoken to some clinicians who work in camps and say you can be treated in camps for one thing, but then your criteria needs to be a lot more severe to then need help in adult care. So it does seem to be that there is a slightly different model that operate within adult services.
I don't actually accept that. I think access to care is based on clinical need, and obviously, that will be the judgment of individual clinicians. To be frank, if anything, we've had less access to CAM services than we have adult. So I would expect Thomas to find it much easier to access care as an adult than he would as a child.
Politics. I don't want to speak because I'm not.
No, I can't stop thinking of expletives, so.
Can we stop for a bit?
I feel exasperated.
Yeah, I feel a bit deflated actually.
Disappointment.
The model of treating people once they're in crisis is broken. It doesn't work. And what a waste of money. Why aren't they doing things to help people before they get to crisis point?
All I can hope for during the next couple of months is that I continue to stay mostly stable, that I need to remain calm for the next 2 months, simply because I'm not sure anything concrete is going to change in that time.
I'm pleased for the people, the young people coming after Thomas who will get the right care, because they are obviously trying to put things right, and I totally understand that they can't just say, right, we're going to do this and it happens immediately.
I don't think I've ever taken the time to thank you enough for everything that you've done for me. I think that you've been not only instrumental but vital for me staying here, and I'm really glad that you were there, because I kind of like the spot that I'm in at the moment. Yeah, so thank you.
Love you.
You too.
Love you, darling. I'd do it all again.
Thank you. Let's hope you don't have to.